Ready?
Hello, yes, yes.
Okay, first of all, I would like to welcome this powerful leader, a fierce patient advocate, an incredible, even patient, a powerful unicorn, and yes, a CEO, my sister, my friend, Maimah.
Aw,
Welcome, welcome.
Thank you. I adore you. Thank you, for being so supportive, so kind, and just for showing up as your beautiful, unique, wonderful, strong, authentic, bad self in the world. You're everything, and you really inspire me to be even more of who I am.
Maimah, this was supposed to be about you.
No, I mean, it's about women being women,
Yes,
right? And
yes. So welcome,
yes.
welcome, and thanks for being here.
Thanks for having me.
So I'm going to start off.
I can tell we're like huggy, right? We're like, yes.
Thanks for being here. I want you to tell everyone about you, who is Maimah, and what inspires you.
But at 31 years old, I was taking a shower, 31, and I loved Diana Ross. So I was like singing,
Which song?
Ain't No Mind High, that song, singing that song in the shower. And there is a lump in my breast right here. And I felt the lump, and you know when things happen to you in life and you just kind of like, you pause. So what is that? And I'm like, doesn't belong here. It wasn't here a month before. And my mom had taught me breast exams at 13 years old, when it wasn't even recommended. And so I knew my body something was wrong. And so I called my OBGYN and I said to her, what's happening? And she said, what do you want for us to do? And I say that because doctors don't often ask, what do you want for us to do? But she asked, what should we do? And I said, I want to get a mammogram. Well, they're not recommended at your age, but you should get one. So you want to get one? I'll help you get one. She did. And went to get the appointment done. And the radiologist laughed at me and said, you're too young. It's going to be nothing. Come back when you're older. And I said, well, I could be dead then, so I'm not doing that. And I got the mammogram and they called me and said, oh, you see, we were right. It's nothing. You don't have any tumor. It's nothing. It's a cyst. And I said, well, it doesn't look normal to me. I want it out.
Right.
But I had to push for almost a year to get a biopsy.
And then what happened?
And when I got the biopsy, I remember the day that I got the call. It was February 28, 2006 at 4:44 p.m. And I knew that when she called the third time, that'd be the last thing I did that was normal for my life change. And so I finished my call very calmly. And then I pick up the phone and she says, you have cancer in your breast. And I'm like, what? And so I'm thinking my mind's reeling, right? I found the tumor on my own. I ignored the recommendations for getting, screening, but I got the screening anyway. Technology, when I got the mammogram, came back negative, false negative. And I said, what would diagnose me hasn't been created yet. It's called innovation. And they laughed at me. And I said, but this is not, you can't see what I can feel. This must be wrong. But the hardest part was getting diagnosed. And they told me there's no treatment that targets breast cancer, the triple negative breast cancer, which, as you know, is most prevalent in Black women and they die at higher rates. So I knew that I couldn't go back to living my life where I would just pretend I didn't know these things existed, because there's somebody out there that wouldn't do a breast exam, whose mother wouldn't advocate with her and for her, whose doctor would blow her off, who would get a mammogram that'd be false negative, who would be told that they had no targeted treatment and just say, okay, I'm not going to do anything. What do I do about that? And I began treatment, wasn't targeting the cancer I had, but I said, I'll do whatever it takes. I remember being in the shower crying. And mom found me and she said, get up out of the shower. Don't ever get on your knees again like that and cry. You're not broken. You're going to get through this. And I said, I don't know, but I prayed the prayer. The next morning I got up and I had the idea in my head for this thing called Tigerlily. And I'm like, what is that? And, but I thought, oh God, like something happened to me overnight. And this thing I felt was about hope, was about beauty and strength and transformation. I wanted women to realize that who you're told you are and who you may think you are is not the fullness of who you are. And Tigerlily began literally after my infusion and building in the infusion chair. And that's kind of who I am. It's this girl that had an idea. It's been, I have no words,
And here we are. So first of all, thank you. That is a lot to unpack. So I'm going to take pieces and bits and pieces of it because there's so much I want to just kind of break down and understand. One of the things I want to unpack is you talked about even your symptoms. And and they were ignored. The way I look at drug development and drug, I guess, delivery is twofold. It could be product-centered or it could be patient-centered. And when it's patient-centered, we're talking about treating the whole person and not just the disease. The problem is all of us are trying to do good, but the question is how? How can we make sure that when someone comes in and says they have nausea, it's not dismissed. When they have diarrhea from the side effects, it's not dismissed. How can we understand the needs of patients and develop the right drugs to meet those needs?
May I be honest?
Fully.
So I just think it makes sense to have patients at the center because patients are the ones that, we're the ones that are having the most urgent need. We're the ones whose peers' lives are at stake or our lives are at stake. I always say, by the grace of God, there I go, right?
Yes.
So I have to push for that equity. And so put the patient at the beginning and all through the process and let them lead. We know what we need.
If we think about why this is important, and you talked about equity. So let's go right into inclusivity and diversity and equity. When you look at breast cancer, Black women have half the survival rate. When you look at prostate cancer, Black men have half the survival rate. When you look at colorectal cancer, and the list goes on and on and on. Race becomes a big factor for death. And how can that be? And so this is why it's so important, to your point, to make sure that we are getting the answers to these questions. Why does your zip code, your race, your ethnicity determine whether you live or die when we have treatments? And so a big push is clinical trial, inclusive research, because we need to understand why, but also we need to make sure that we're supporting patients throughout this whole journey and making sure that they get access to these drugs, these innovative medicines once we find a solution. When we talk about Tigerlily, we're talking about a grassroots organization that truly reaches the people. So how does Tigerlily make sure that research is inclusive? Why does Tigerlily do that? And how should we support it?
One of our core programs trains angel advocates. I love the word angel.
Yes.
We want to be angels in life, right? We want to give our sisters something that's a beautiful gift that carries a light, a spark. But they're trained to be advocates. The program has 15 modules, 5 are mandatory. But they learn to understand everything from cancer education 101 to self-care to clinical trials to biomarker testing to policy to all the things to be empowered to be able to have that talk with their doctors, be empowered within themselves, but also to erase the legacy of the badness things that happen that make us not want to trust in trials anymore. So we think about the past did happen, but how can you transform your future and make it better for your children and their children's children? So they have the program, they have this cohort they're trained in. The cohort becomes so close, they share stories, they build sisterhood. And then when they're done, they are given opportunities to go and speak on stages and be a part of clinical trials as a co-creator.
Yes.
They get a chance to go on Capitol Hill, be on the state level doing policy work, or being on this federal level doing policy work. We get to travel and do campaigns and be influencers and help to educate their communities on the importance of, biomarker testing, of, drug delivery design and of how to be. They're becoming diverse healthcare workers. So they're learning to speak.
And empowering themselves and the people that they're speaking to.
Well,
so they can understand.
The empowerment, it comes with you becoming an angel for yourself.
Yes.
So we're creating this beautiful force multiplier of women that are now, we trained 400 women last year to become angel advocates. And through a grant from BMS that is now a completed grant, we're able to reach over 2.2 million women. We had 5 patients that were part of an angel lead pilot. So we took 5 women who were either in treatment or just post-treatment and said, they went through a vetting process and we said, do you want to be an angel lead? Yeah, I do. And they got work to do and they got busy. Yes. And these 5 women in these 5 disparity communities went and reached over 2.2 million people. They made over, I think, 3,000 clinical relationships with hospitals and nurses and doctors. They created materials, publications. They did so much to eradicate barriers in their communities. So my job is to help them, give them that, the one I help them, they know what they're doing, give them that platform and believe in themselves. They can do this work and go and do it.
So you spoke a lot about empowering these women, but let's talk about the barriers. Because when you look, again, I talked about the data, but there's so much more that's also stopping these women from getting true innovative care. And a lot of times I notice that people tend to blame the patients and say they don't trust, and that is why they don't come on the trials. I know there was a study done at ASCO, was it I think like 3 years ago, when they spoke to Black women with breast cancer and they asked them about getting on a clinical trial. Over 75% of them said they would get on a clinical trial. However, when they were asked how many of them were asked about a clinical trial, only 40% were.
Wow.
So the number, so when you look at the data, it's more than just not wanting to, because that's not what it shows. A lot of them are not even being presented. And we understand that there are differences when it comes to race. We understand, for example, a lot of times Black women, our white cell counts tend to be lower. We understand even when you look at Black men and you look at prostate cancer, testosterone levels are different. And a lot of those things even keep us out of being able to come on clinical trials. And then the other piece is, are they even asked? We all have our own biases. And so what I'm learning is we're not even asking sometimes because we assume that Black women and Black men do not want to come on clinical trials. And then you have other barriers. When you look at even accessibility, like real tangible barriers, how do you get to and from? Because a lot of our trials are in the academic centers and not necessarily where the patients live.
Yeah.
How do you take time out of your day? You get diagnosed. It's not like you're sitting around waiting to be diagnosed. You have your daily life. You have your family that you're taking care of. And so you have to now make time to come to a clinical trial in a community that's not even yours. And so there's a lot of things to overcome beyond a trust factor. What does Tigerlily do to make sure that they're helping overcome those barriers?
We know that there's things that are scary, but also when a patient understands the bonuses, I've never met one patient who wants to die.
Right.
Right? No one's going to say no.
Right.
So when you explain to them what a trial looks like, we had a campaign we recently did with a sponsor where we funded a national clinical trial educational campaign, and they let us create the entire campaign. And one of the most impactful videos was showing a patient getting dressed to go to a clinical trial and going to get her clinical trial dedication.
Yes.
She got dressed like we get dressed in the morning, put on makeup, got in her car, got to the center to get her infusion, got her medication. People were like, that's what a trial is like? Yes. But it was simple as saying, here's what it looks like. And then here's a toolkit to ask about before you even start, these barriers and how to meet them. So you come into it with a plan. So we help them create a plan for when I start treatment or a trial, I can overcome these barriers by partnering with that, getting money here, getting food there, getting whatever you need. But we're building a place to have that as a one-stop shop. We created a really awesome platform that still needs funding, and it's called Raise. We want to raise the patient up. But imagine being a patient and you go into a system, a platform, you plug in your information that you're there for a treatment or a trial, and the sponsor would fund the cost and put it into the budget before the trial even starts.
Yeah.
You could say as a patient, I need to travel XYZ amount of times back and forth, and groceries, maybe some housing, whatever your needs are. So imagine using the Raise platform when it's funded, and you just put in your data as a patient, push that send button, and your needs are met.
Yes.
That is so powerful, right?
Yes.
I mean, people are doing good work out there, but things are siloed. You have to go here for financial assistance. You have to go here for rides, here for meals. What if you had a one-stop shop for everything?
Yeah. There's a few things. Number one, let's talk about location of trial. To your point, if it's in the city and the patients aren't living in those big areas, how do we get them to the trial? How do we get them, to your point, getting food? And I think there's things that we need to do as an industry in bringing the trials to the communities.
Make it convenient, make it easy.
Yeah.
Make it you can put parts in the house, but part you can do in a local clinic. You know what I'm saying? So I think just making it easy.
And so let me ask you this question, and then I want to switch it.
That's why I get fired up.
No, but this is good, because I think, to your point, people are putting in money everywhere, and it's very dispersed. If you think about getting, and I call it inclusive research because it's really making sure that this research represents the patients that actually have the disease. And a lot of times, even if these patients, particularly patients of color, are getting treated, because they weren't on a clinical trial, sometimes the treatments may not work specifically for them. Patients are heterogeneous. And in order to really understand and develop the right medicines for these patients, they have to come on a clinical trial. We have to understand their disease better. And so when we look at the top 3 things that you think we need to focus on. And again, that's why I kind of break it down and say, is it eligibility criteria? Because we need to fix that. Is it even just consent forms? I mean, consent forms, unfortunately, are in usually one language and a book long. Is it really teaching these physicians how to speak to their patients, giving them courses on true inclusive research? Is it decreasing the barriers to and from? If you want to speak to pharma and say, this is where I want you to focus your monies, your funding, your sponsorships on, like, what would be the top 3 things you think we need to focus on?
I think the biggest barrier, to be honest, I mean, I'll explain, there are more, but I think the biggest one is that we have a sick care system, not a healthcare system.
Yes.
People aren't asked about things until they're sick.
Yes.
When you're sick, you're in trauma. You don't understand certain things.
Yeah.
If you're taught about clinical trials early, biomarker testing early, about what to ask about these things, we're taught sex ed in elementary school, in high school. So how do we talk about healthcare in a way that can make sense for people early and often and throughout their life? So when things happen, they're empowered, they're educated, and they know what to do, right? I think beginning early is important. Asking a person who's traumatized to look at ICF forms, protocol documents, looking at the criteria, looking at, they're overwhelmed. They don't know what to even ask about. We had one patient who became homeless. She didn't know what to do because she was overwhelmed. And so having that navigation is important. Having navigation, peer navigation is critical. Yes. That's why I keep going back to the Angel program. We have built and are now going to roll out soon a peer navigation program. So we're the gap between the provider and the patient. Doctors have to learn to be more humble, to pause, to listen, and realize that Tania is one person, Maimah is another person. We're both different.
But not only that, right? I mean, if you want to talk about that, patients should be in the driver's seat of big care, and we
100%
serve you.
100%.
And I think if we look at ourselves as servants of patients, we are in a business that serves patients, then maybe, to your point,
educating doctors about their biases and what to think about, how to pause, how to listen, when to be quiet, when to say, what do you want to do? What do you want for us? What do you want for us to do is important as well.
Let's talk about partnership. So how can we partner? How should we partner with organizations like yours who are actually speaking to patients, work with patients to move the needle so that we can have both, so that we can have lower drug prices and at the same time really pump the R&D engine so we can continue to have innovation? How do we partner?
How much time do I have?
I think you got 5 minutes.
Oh my God, I got 5 minutes. 5 minutes, okay. I would say that it's about a relationship, not a transaction.
Yes.
And so the relationship means that you get to understand what the patient's needs are and the patient organization's goals are. For Tigerlily, the goal is to have patients involved in every phase of the drug development, delivery, and getting it to market. So we have patients that are trained to engage, just to support pharma and to partner with pharma, right? Leading the charge with pharma. So patient centricity, really acting it out and implementing it is key. I would say beginning with the patient. When you start with the patient, don't call us in when you're halfway through, when the pie is baked. I would also say that the investment comes back to everything. So like investing in patient groups in a way that's substantial and consistently over time. It has to be where we're getting money to educate people, to go in the community, have the conversations, be on the basketball court, be at the Ben Chili Bowl, be in the rec center. We have to be in those rooms, in those conversations. We have to be with people on the ground where they are. Investing in us to be able to be out there and be thought leaders. I think a lot of people don't know what's going on as patients. Yeah. I didn't know what was going on as a patient when I was first diagnosed. Yeah. I had to learn. Yeah. So it's a partnership, and there's assets you all have, educational resources, there's access to policymakers and things like that, and clinicians. And so I think bringing the best of what pharma has to offer with what we have to offer together is going to be where the deal is going to be won, right, in true partnership.
It's interesting. You talked about, again, bringing the patient at the beginning. There's something that I like to call patient-driven science, where the patients are driving our science. We have the technology, but for us to develop our technology appropriately, we have to understand what the needs are. And so if the patients are people diagnosed with a particular disease are at the table, once we have this technology, how do we develop it to make sure it's meaningful for those with this disease? So I agree. I think that to me is true partnership. It's not bringing them at the tail end. It's actually saying, let's develop this together. Let's understand what the needs are. The multiple needs are. Let's develop our medicines for that. So completely agree. And before we wrap up, I just want to ask any question. I have one question for you. Anything else you want us to know? Anything else you want to say to the pharmaceutical companies, to the healthcare workers, to the healthcare ecosystem? Anything you want to say?
Only one thing. I have two. I have two.
Go to three.
So there are three things I think that I want to ask pharma and healthcare providers and policymakers to understand is that we want to partner with you. So we have an amazing organization called Tigerlily Foundation. Our core program is our Angel Advocate program that understand how to amplify and act on anything within the healthcare space. I want to reach over 1 million Black women with the importance of their body and their breast health, importance of their health in the oncology sphere and healthcare in general. So let's partner with the Angels, support us with the program. We want to get involved. The second thing is our Empower Ball is coming up on October 19th. It's going to be at the Waldorf Astoria
and we're co-hosting.
At the Waldorf. We're co-hosting. Yes, it's going to be lit. So be at the Waldorf 10/19 in DC, nation's capital. Please sponsor. The money goes towards helping patients become more educated, more empowered, and get access to life-saving medicines and to be part of the ecosystem and to have overcome barriers and to be empowered when it comes to their breast and overarchingly their women's health, not just breast cancer, all cancers. The third thing is we want to be involved in the drug delivery process. We want to be partners in that process, not just recipients of it. So as you're building clinical trials, call Tigerlily up. We want to support you throughout the entire process. We are ready, we're able, we're willing. So we want to partner. How do we do that? We're in the community. We live there, we work there, we play there, we pray there, we slay there. So let's work together to make a difference beginning today.
Well, thank you so much.
Thank you.